Good morning and welcome to ICUS Bubble TV. I'm Linda Feinstein, and today I have the pleasure of speaking with Dr. Wilson Mathias from Brazil, who will discuss contrast-enhanced ultrasound and ultrasound contrast agents or ultrasound enhancing agents and some of his pioneering work in the field. Welcome and good morning. How are you today?
Just fine, Linda. Thank
Good.
you very much. It's a pleasure talking to you.
Thank you. Could you tell us a little bit about yourself first, and then I'd love to hear about your work.
Okay. I'm a cardiologist. I directed a large operation in the University of São Paulo Echo Lab at the Heart Institute in Brazil. And I've been working with contrasting and enhancing agents for the past 20 years. It's a unique technique because it uses ultrasound as a means of diagnosis. You have no ionizing radiation in this technique. And it's a technique that can be done at any site in patient care, ICU, in clinics, any setting. And contrast enhancing agents, they improve significantly the patient's diagnosis, for example, detecting intracardiac abnormalities like thrombi, which have a huge impact in therapeutics, cardiac masses. You can differentiate if a cardiac mass is a tumor or if it's a thrombi, and improve significantly the evaluation of cardiac function, Doppler studies. So it's a huge number of benefits that you get in a very safe environment. You can do it in clinics, and it's a very simple injection in a peripheral IV line. So I think it's the greatest technique for cardiac diagnosis that I've seen in my 35 years of career.
It's a wonderful, resounding endorsement, Dr. Mathias.
Thank you.
Can you tell us about some specific patients who have come to your lab and how contrast has benefited those patients?
Well, I have one very striking patient that's a friend of mine, actually. It's a physician. His father had hypertrophic cardiomyopathy. As you know, it's a genetic form of disease that can have a very good follow-up. The patient can live up to 90 years, but they might have sudden death, they might have embolism. And this particular patient, he was just fine. And with the regular study, I didn't find anything. But there is a very rare form of hypertrophic cardiomyopathy where you have a very small aneurysm in the apex of the ventricle that's hardly seen by transthoracic echo. And when I did the contrast ultrasound, I found 3 millimeters thrombi just floating in that aneurysm, meaning that this thrombi could go to his head and cause a stroke at any moment. So that was a unique diagnosis that changed his life because he was anticoagulated at that moment. And he's still using this anticoagulation, and there is no thrombi in there anymore, and he's not running risk of having a catastrophic clinical event. He's a young guy, 40 years old. So, and I have probably 100 cases of similar to that really changed the patient's life. And he was about to have a stroke because the thrombi was just floating right there in the systemic circulation.
And so you could not have seen that thrombi with conventional ultrasound unless you added the ultrasound enhancing agent.
I was using the top-of-the-line high-end ultrasound machine. It was a very small detail that is quite hard to image. Right. So that made a huge impact for this physician, actually. But I think for in several other instances, contrast changed the patient's life in my experience. And it gives us so many other important information. As you know, Linda, I work studying coronary artery disease. And in patients with chest pain, sometimes we have a very hard decision to make because they arrive in the emergency room with chest pain. Sometimes in 50% of times, EKG doesn't help much. So you are in between putting this patient in hospital. That may be unnecessary because chest pain may not be from the heart, or you may be running the risk of sending a patient with acute myocardial infarction home, which is another catastrophe. And contrast ultrasound can help you detecting the areas with no flow in the heart, which is quite easy thing to do. And with that, you can see if the patient is having myocardial ischemia, if he's prone to have a myocardial infarction, and hospitalize and intervene immediately in this patient, or you can send him home with no risk of having any significant trouble. Another issue is sometimes even in patients with acute myocardial infarction, you look at the EKG and it looks like that this infarction is already evolved and the patient had necrosis, and sometimes you don't rush much for catheterization, trying to open quickly that artery. But when you do contrast, many times you see that the actual infarction is small and this patient still has a very large area at risk. So you must rush to save this patient's heart function. So it's a fantastic technique. I love it so much.
It sounds like it's simple, very safe and life-saving, and something that you use quite frequently.
I use quite frequently, and I think that one of the biggest challenges the medical community has to undertake is the area of medical education. And in this regard, ICOS is fantastic. ICOS has done so much for world community in this area. So I think we are in the right path.
You also are pioneering a new life-saving adaptation of contrast-enhanced ultrasound called sonothrombolysis. Will you tell us a little bit about that, coming soon to an ambulance near you?
Yeah, well, that's a fantastic technique, because I'll tell you about my country's problem. In Brazil, about 60% of patients with acute myocardial infarction, they don't have a quick access to a catheterization lab or to even a thrombolytic agent, which are life savings.
And forgive me for interrupting, a thrombolytic agent, for those who may not know, is?
It's a pharmacologic agent that dissolves the thrombi. And it's not because we don't have it, we have it, but many physicians are afraid to use it because of risks. Risks of hemorrhage, intracranial hemorrhage, and other risks, usually related to hemorrhage. And with this technique, we know that when you apply ultrasound in the heart, these bubbles vibrate, and they enter inside the clot that is occluding the coronary artery. And you can explode them. They are very small, they are a third of the size of a red cell. So they don't cause any heart damage. And you can cause micro explosions and dissolve this thrombi in order to recanalize this artery that's clogged. So in this technique, we studied 100 patients in a very well-controlled randomized study and demonstrated that you can open up the coronary arteries in a completely non-invasive fashion and with basically no risk. So we can apply it in the ambulance as soon as the care gets to the patient with chest pain. If the patient is not having a myocardial infarction, basically there will be no side effect. If he's having a myocardial infarction, it will be a life-saving therapy that I'm sure that will change medical practice worldwide, because it can be applied in several other instances like stroke, deep venous thrombosis, pulmonary embolism.
This is remarkable. This is incredibly exciting. You can tell me that, so you're telling us that you can take a patient who has chest pain or experiencing an acute heart attack, and while they're in the ambulance on the way to the hospital, you can administer a contrast agent intravenously. The contrast agent can bust the clot and save the patient's life.
Exactly, and actually our view of this technology, we are doing studies as a proof of concept, but our view is that it's going to be, the sonothrombolysis will be applied in the future with a non-imaging probe, with a very small machine that can be even performed by a paramedic. Once they send an EKG through telemedicine to the hospital, a myocardial infarction is demonstrated, he can immediately start in the ambulance applying this technology, even for a heart attack and maybe in the future for a stroke and other issues. In Brazil, for example, sometimes in small cities, patients, it takes days for them to get to a hospital with infrastructure to do catheterization. If you can have this type of infrastructure, which I foresee won't be that expensive, patients can be treated in their cities and maybe transferred to a tertiary hospital 2 days later to get the main treatment. So I think the future is bright in this area.
This is remarkable. So what we have are ultrasound contrast agents or ultrasound enhancing agents for both diagnosis and for therapy, and they're safe, they're convenient, and potentially life-saving.
Exactly. You summarize it.
Thank you very much, Dr.
Thanks, Linda. It was a pleasure.
Dr. Wilson Mathias, we've really enjoyed speaking with you today.
Thank you.